Hello, everyone. Welcome to our webinar on preservation deep plane face and neck lift. I'm Dr. Minas Constantinides, and also joined is Devin Wright, our
Hi.
consultant. Devin will be your point person for questions. She During the webinar, if you have questions that come up, please click on the Q&A button. If you don't see it on the toolbar on the screen under more, you'll see there should be a Q&A option. If you click that, it'll kind of stay on the bottom of your screen, and that way you can type your questions. There's no way we can allow for actual verbal questions, so Devin will be reading your questions at the end of the webinar, and I'll do my best to answer all of them. Um, so, without further ado, let's get started. Second to share my screen. Here we go. And here we go. So, preservation deep plane facelift. I'm Minas Constantinides. I work at Westlake Dermatology at Lamar Central, which is at 38th and Lamar in Central Austin. And this is where we have our fully accredited operating room, our surgery center, and all your preoperative and postoperative care would be done here. Um, I'm double board certified in facial plastic surgery and in otolaryngology, which is head and neck surgery. And I've been in Austin now for 10 years. This webinar, we're going to also introduce a new VIP recovery package that all facelift patients are able to take advantage of. And we'll go through details as to what that includes and what benefits are included in facelifting here at Westlake Dermatology, especially by me. Um, and what we are trying to achieve is a transformative change, a change where you go from looking your age to looking better than you do now for your age. So, it's you can argue whether someone looks younger after a preservation deep plane face and neck lift. I think in many cases, because people look so much better than they do for their age, they end up looking healthier and younger in the sort of overall sense. But we're not actually making turning the clock back. We're moving tissue and filling voids of tissue in ways that keep people looking great. So in this before and after, and we'll go into more detail on her later, but you can see really a transformative change. And that's our goal for this kind of surgery. Here's a little bit about me. I really have spent my career dedicated to advancing facial plastic surgery around the world, really. Um, I was the founding director of facial plastic surgery at NYU Langone Medical Center in 1994 after I finished my fellowship and stayed there for 20 years. And there I taught and I did research and I trained fellows and residents in facial plastic surgery. I also had a private practice in facial plastic surgery in Manhattan during that time. And I have spent time being a leader in the field nationally. I was on the board of directors of the American Academy of Facial Plastic Surgery for a long time. I was director and then a senior advisor, as I still am, for the American Board of Facial Plastic Surgery. In 2015, we left New York. It was 20 years in New York in practice. I was looking for a place to sort of be a little happier in my lifestyle. And I joined Westlake Dermatology in 2015 after we moved my family to Austin. My wife was a UT grad in nursing, and she always loved Austin, and so we ended up finding a way to get back here. Um, in 2018, I was the founding president of the South Texas Society for Facial Plastic Surgeons, a group of sort of supporting like-minded and likely like trained surgeons throughout the Central and South Texas area. And so I'm really proud about what my career has led to me to date. And just for perspective, um, deep plane facelifting has been something that I've been doing for the last 25 years. And so I've seen all kinds of advances in the field, and I hope to share some of those with you today. So, what happens as we get older? Here's that patient we saw earlier. Structural changes happen with age. The skin changes, the brows can descend, causing hooding or heaviness of the upper eyelids. The upper eyelid skin itself can become excessive and redundant. Usually, it's a combination of the two of these things that cause the heaviness of the upper lid, and especially as we get in the over 55 age range. Lower eyelid bags occur. The wall that holds fat back gets weaker as we get older and bows forward. But it can't bow, the fat can't go further forward than this crease. So it creates a shadowing at the tear trough or this crease because this ligament inserts on the bone there. We're not talking about lower eyelid surgery today, but if you would like to learn more about upper and lower eyelid surgery, as well as brow lifting, which we also will not be talking about today. Um, I did a webinar a few months ago on that, and all the webinars that we've done are on the Westlake Dermatology YouTube page. So go to YouTube, search Westlake Dermatology, and you'll be able to find all kinds of webinars about all kinds of interesting things that you might be interested in. Now, in the midface, facial fat descends and we have volume loss due to both bony resorption of the cheekbone and the jaw and the mandible, the jawline. Volume loss from superficial fat losing becoming lost, and laxity of the ligaments of the midface and of the neck. So and we'll talk a little bit more extensively about that in just a second. So this is a cross section of facial anatomy, and I don't want to bore you too much with anatomic discussion, but it's important you understand why deep plane facelifting is so amazing and why it's really the only type of lifting that I do. So what happens? Layers of the skin, subcutaneous tissue, this fascial layer, number three, which is they call a musculoaponeurotic layer, and that's the SMAS. And then there are retaining ligaments between the SMAS and deeper structures, either muscle or bone. And then there is periosteum, lining of the bone, and deep fascia of the muscles. And so when we talk about the older style facelifts, the SMAS facelifts, what the surgeons would do is raise the skin and the subcutaneous tissue off the SMAS, off that deeper layer. Um, and 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 then they'd pull on this layer. Now, sometimes there'd be a little bit of an elevation of this layer and then pulling, but it was never a very extensive release of that layer. And the problem with that is that these retaining ligaments prevent the face from moving and staying where it's been pulled using that technique. And so you get an early improvement. You get 5 to 7 years of sort of jawline tightening and improvement. But just by pulling without releasing, is this face easily will settle back down. Um, the deep plane lift elevates underneath the SMAS, and it's by doing that, it not just elevates, but releases these retaining ligaments. And so why that's important, if you right now put a little finger along your jawline and pull back, and you'll see improvement, right? I mean, I'm 65. You get a little improvement along the jawline and neck. And if you put another finger up higher and pull sort of in an oblique way upwards, you get improvement of the midface. But why doesn't that improvement stay pulled up? Well, it makes, of course, it's not going to stay if you just use your finger and pull it. But it's the same idea with older style lifts. They're just pulling. What you need is to release, the release to free up the the SMAS layer, so it will move without much pulling, just move to where it needs to be or where the surgeon can place it, which usually is about 15 years ago. So we get about a 15-year improvement in where things are. With the neck, it's the same idea. We release and move that layer. So that's the key to that's what deep plane facelifting means. The release should be extensive enough so that everything frees up and moves easily. So here's a sort of a complicated slide talking about everything I just said. So another view of the retaining ligaments and where the release has to happen for a long-term improvement of outcome. So the release and repositioning doesn't require a lot of pulling. There's really very little pulling. And so by not pulling, which has to the pull has was had to be pretty hard in the days of SMAS lifting because to get any improvement, you got to pull pretty hard. But the problem is without that release, you get a swept look of the skin as things sag back down over the 5 years or so. And the neck itself can't be redistributed along with the midface. So very often the surgeon would pull on the neck, but there would be no mid-face elevation, and so you get this swept look that doesn't look good. Um, so that's the inherent differences. Now, two really good friends of mine that have really transformed deep plane facelifting in the last, I would say, 5 to 10 years are Mike Nyack and Ben Talay. Mike is in St. Louis, Ben's in Beverly Hills. I've spent time in the operating room with both these surgeons and have incorporated a lot of what they've done to improve the field of deep plane facelifting in my practice. And I think it's been transformative. And not because the lift is any better, really, but because the healing process is easier for patients and the predictability of outcome is greater. So let's talk about all of that. So here we see that same patient again, this transformative change. And some things that we see, our eye sees, but they're hard to put your finger on, that I'll point out now, are really things that help you look so much better after surgery. One is look at all these mid-face, mid-cheek creases. When you smile, are you getting that? Well, if you're getting that, there is marked improvement in the creasing because the creasing comes from the pleating of the SMAS. And if we have released this mass and redistributed it further back or up and back, really, it's more up than back. If by releasing that, all the pleats improve. You see, she also had a brow lift. She had an upper and lower blepharoplasty, and she had a peel around her mouth. But the the pleating that she had, the creasing, is much improved. Now, of course, around the eyes, so Botox is really helpful for that still. And facelifting does not remove the need for Botox. Sorry, it just doesn't. It does eliminate the need for filler, though. And we'll talk about where that can be helpful in a few minutes. So three-quarter view, you see how the whole SMAS layer by sagging creates this loss of definition along the jawline. Her jawline is no longer a long, elegant jawline. It's a very short jawline. It looks like it's here only with a hollow where the jaw should be. And then she has the neck muscle heaviness. Now the platysma starts in the collarbone area and goes up and changes to the SMAS. So it's the same layer in the neck and in the face. The platysma in the neck is muscle, and then as it crosses the jawline, it turns into this fibromuscular a fascial layer called the SMAS, and that inserts on the cheekbone. So the deep plane lift needs to release all of that so we can move it all as a unit. And by moving it as a unit, it looks natural. It looks just like where it belongs, and By moving this whole as a unit, we're getting fat brought up into the midface, which has fallen down. And so in this patient, we didn't do any fat transfer. All I did is a lift, redistributing her own deep fat where it belongs to create great contours along her jawline, along her cheekbone line. And by moving the platysma back up underneath the jawline, now we've recreated a long, elegant jawline. And that looks great. Now you see there's a little still redundancy in the midline of the neck, much improved than here. But in this case, I didn't do enough in the submuscular in the anterior neck, and so she has a little bit of platysmal redundancy. Smile lines much improved as we talked about before, and she's just doing great. Incision lines hard to find at 6 months. They're placed behind the tragus typically to hide well. You see a little red line here that will continue to fade. And incidentally, um, things that have to do with skin surface, like little dilated blood vessels, are not necessarily treated with a facelift. They're treated with lasers and other things that we can do afterwards. Heaviness much improved. Different patient. So this patient now had a deep plane facelift. Um, excuse me for just a second while I reorient things a little bit. Had a deep plane facelift only. So she had had previous upper blepharoplasty. There was nothing more to do there. Her brows were in good position and her lower eyelids looked good. So she didn't need anything done in the upper face. In her mid face, though, and her jawline, she'd lost definition. So we want to recreate a long sweeping jawline. We want to improve some of the heaviness that is creating more shadowing in her nasolabial folds than she needs. And we did a little filler in her lip, most likely. Well, that's where filler comes in handy. Um, Jawline much improved. This long sweeping jawline has been recreated for her. Uh, all the subplatysmal heaviness, this is a submandibular gland that's excessive, causing fullness in that area, have been improved. And by improving what's deep to the platysma, by making room for the platysma to move up underneath the jawline, we get a much enhanced appearance post-op. Same kind of idea. You really see the improvement in the neck and jawline. One would not be enough. Everyone's asking these days about mini lifts. Well, why can't I get a mini lift? Well, if you have this much laxity in the jawline and neck, pulling the SMAS from back here, which is what a mini lift does, it raises the skin and just pulls in the SMAS and then closes. Yeah, you get a little tightening, but nothing that's long term, nothing that's going to last like a deep plane lift. Deep plane lifts, their longevity, because we're moving things 15 years to where they were 15 years ago, we get about a 15-year longevity. It's rare for a patient to need a second one of these in a lifetime, even if you have one done in your 40s and 50s. After GLP-1s, a lot of facial fat loss, lines, wrinkles, volume loss, no fat transfer, just a lift. Deep plane facelift to release and move fat in the deep compartments up to where it used to be, improve the smoothness of the mid cheek skin, and improve neck. So we see marked improvement when she smiles of all the lines that she used to have. We see marked improvement of jawline definition. Of course, she still has a little bit here. The deep plane lift fails as we get close to the corner of the mouth. It doesn't fail. I mean, it's much better than it is before surgery, but there are limits to what the lift can do. And patients are, and we talk about that beforehand, and I try to be really clear about what this lift can and cannot do. Looking down, you could all look at all that laxity that's been improved now, and she just looks great. Three-quarter view, again, same kind of idea. Volume up, cheekbone definition improved, jawline, long sweeping jawline recreated. Gorgeous outcome for her. Really, when she smiles, you see all that improvement in smile lines, which is amazing. Okay, so we've been talking about a deep plane lift, but what is a preservation deep plane lift? So in words, basically, a preservation lift raises less skin. It preserves the attachment between the skin and the deeper layers of the face, between the skin and the SMAS. So in the older lift techniques, we used to raise the skin a fair amount, up to 2 inches, to be able to then get underneath this mass and move everything. But Doctors Talay and Dr. Talay in particular, but also Dr. Nyack and other surgeons around the world have been experimenting with raising the skin less and less. And so now we're down to anywhere between a little under an inch and a little bit over an inch of skin elevation in front of the ear. So instead of raising all the way halfway down forward to the cheek, now we're raising a smaller amount, and that leaves the skin and SMAS attachments intact. Why is that important? Blood flow to the skin is preserved better, and so healing is faster along incision lines, and there's less dead space for blood to accumulate, so less chance of a hematoma. So we used to also elevate all the way across in the neck. And now we're just elevating in the central neck to get access to the platysma in the midline so we can get underneath it and work on it. And then elevating um, from behind the platysma all the way forward. So we're releasing the platysma completely underneath, but the skin is only being elevated a short distance. So here's a picture of that woman, what a standard deep plane lift elevation would look like, and what a preservation skin elevation would look like. So we're leaving intact bridges of skin and less elevation in front of the ear. We're doing even less than that now. Here's a picture from Dr. Talay's article about all this, where with a regular deep plane lift, this was the elevation, the green, and then the resultant flap after the lift, there is that much skin still that had been elevated. Now, with a preservation lift, there's less skin being elevated in front of the ear, less skin being elevated across, just in the central neck. And then after the lift is complete, the amount of skin that's actually elevated under which things can accumulate is behind the ear and a little bit in front of the ear. It's much, much less. So here's a preservation deep plane lift, upper and lower blepharoplasty, and here is a periorbital around the eyes header peel. It's a deep peel to create profound smoothing. And we see marked improvement in heaviness around the eyes, of course, and around the eyelids. The lower eyelid looks better, but the lift itself, the deep plane lift, restores volume in the upper midface, improves nasolabial fold depth, and improves jawline. You see that even in a younger patient like this one, who's in her early 50s, she was starting to get some pulling, and there's improvement of that. And she just looks natural and like herself, just better. And we'd never want patients to look anything but like themselves at the end of this procedure. Jawline, restoration of a long, elegant jawline. This jawline looks like it's short from here to here. Now it's a nice, beautiful, long, elegant jawline. Muscle tethering is improved, and volume in her midface is improved. No fat transfer, no fillers, just lift to restore volume in the midface. She looks down. Look at all that redundancy in her neck that has been improved and around her jawline. Just amazing. Now, I thought you might find it interesting to see what happens early on in the recovery of patients. So this is a week after a preservation deep plane facelift and a perioral or a deep peel around the mouth. Deep peel because of all the skin lines and damage she had, and a preservation lift at now nothing done to her eyes, right? Didn't want it. She just wanted her face done. That was what bothered her. Look at her neck, how improvement in the quality of her skin just from the preservation lift. And then at 3 months, she's healing beautifully, restoration of all those beautiful landmarks. Looks like herself, looks super natural. All these mid-cheek lines much improved, neck markedly improved. These little spots are spot peels where she had significant sun damage. This spot is that spot. Look at how far it's gone with the lift. And at a week, this is when the stitches come out at a week, and everything looks so much better. As she looks down, marked improvement of the redundancy she had before surgery to where she's healing now at 3 months. And same kind of comments here. Restoration of that long, elegant jawline is key. Okay. One thing, one thing that's interesting with these surgeries, look at where her chin looks like it's really close to her neckline here, right? But look at the marked improvement in that long sweep between neck and front of her chin. This is what the preservation deep plane lift can do. It actually repositions some of the deeper structures sorry, some of the deeper structures in the neck so that we can achieve this long, new jawline that she probably never really had even growing up. Still looks like herself, but with really amazing enhancements. Okay, let's talk about the VIP recovery package. We're introducing that today, and here's all that's included in this recovery package. By the way, patients have asked, well, if I don't want this recovery package, do I get a discount? No. This is included in what you pay for surgery. You don't want it? Fine, but it's all included. You don't have to have it. Anesthesia is included, either IV sedation by me if it's a shorter procedure under 8 hours, or general anesthesia by a CRNA team if it's a longer procedure, longer than 8 hours. Um, Premier Recovery Aftercare. So this is a aftercare facility in North Austin who provides transportation from the operating room to their facility overnight, the first night. You stay there 2 nights. They'll bring you back to see me the day after your surgery, where I need to see everyone to take their dressings off, make sure they're healing okay, and make sure that you know how to take care of yourself. Then they take you back. You have 2 nights there. They provide an incredible diet that helps with recovery. They'll perform lymphatic massage during the time that you're there. And you can even have one of a companion stay with you while there. Hyperbaric oxygen therapy is included by ATX Hyperbarics. A package of 3 is provided. We usually recommend that start the same week of your surgery. And then lymphatic massage, a package of 4 treatments beginning 1 week after surgery. In addition to the 2 treatments, you'll get one a day while you're at the recovery center. So a total of 6 lymphatic massages included. These 4 are by a different provider than the Premier Recovery Aftercare provider. If you need Fraxel post-surgery, patients with thin, crepey skin in the neck, that crepiness, it's a superficial problem. It's not always improved by deep plane lifting. If it's not improved and it comes back, especially during the contraction phase of healing, which is during the first 3 months of healing, then we will laser that. It's included in your surgery, and all your products and supplies are included. These are my favorite products for healing. The Men Nutritional Supplement is an amazing shake that patients hate the taste of, but does wonders for their healing process. And then all the sort of over-the-counter stuff that you need. And so all that is included in our recovery package. It's an amazing opportunity to take advantage of this. I'm going to skip over fat and nanofat. I'll just point out that this is a fat transfer patient 1 month after fat transfer. It really takes 6 months to heal, but just, you don't see lots of volume changes, but you see just softening and a brighter look. And that's really what fat transfer does. Well, these are all the places I put fat in her to improve volume in these areas. And she just looks great. Skin quality improves. You can see improvement. Some of that's the products we recommend, but some of it's the fat. before and after fat transfer. So, common questions that we've gotten. How long does the preservation deep plane facelift take? It takes 6 hours. It's a lot of work to get things done right. I don't look at the clock when I operate. I just work until I'm done. Typically takes about 6 hours. What now, if you're going to add eyes and brow lift, now that's an 8 to 9 hour surgery, and that's where general anesthesia is required. But just preservation deep plane facelift, we can do it with IV sedation and anesthesia, so you don't have to go right to sleep. Your recovery's a little faster. I'm scared of pain. Well, first of all, during the procedure, no one remembers anything. We give you medications that make you forget, and you're not aware of anything while you're sleeping through your surgery. Um, Postoperative pain, our routine tries to avoid narcotics as much as possible. We prescribe narcotics in case you need it, but the other things that we use tend to make narcotic use quite rare. And most patients only, if they take a narcotic, it's only for the first 48 hours. How can I heal faster? Well, we'll talk very extensively during your preoperative visit about strategies to heal faster. How long do the results last? We talked about 15 years, although again, it's unusual for patients to need another one of these. Do you use drains? A lot of surgeons around the country have stopped using drains. Instead, they use um, something called a hemostatic net, which is a suture that they place that comes out at day 3 or 4 to help to compress the dead space, close any space underneath the skin. It's not necessary in the deep plane area, but where the skin only is raised, here and here, sometimes a hemostatic net is used. I use drains instead. I think it helps to pull out swelling faster. I think patients heal faster. They stay in for 2 or 3 days until the drainage is low enough that we can remove them. After surgery, on day 1, there's a bulky overnight wrap placed. We see you the next day, take that off, put a smaller one on that you can take off and on yourself. On day 3 or 4, the drains come out. Day 7 is when sutures come out, and the compression with a wrap is really only required at night after that in most patients. At 2 weeks is when contraction phase starts. So before that's inflammation, the body's starting to heal. Contraction, things heal in. We massage with a vibrating massage bar called a beauty bar is helpful. Lymphatic massage is helpful. Patients can return to more limited work and can fly after 2 weeks. By 3 to 4 weeks, you're having dinner with friends. I don't have any strict restrictions of activity. You can just get more active, and as you feel better, you can get more active. As long as you're not causing pain or swelling, you just progress. And everyone's a little different, but by 1 month, everyone's pretty much doing what they want. At 2 months is when, you can feel comfortable going away on vacations, public speaking, taking pictures without worrying about how things look. And the numbness begins to fade. Numbness is normal in the area underneath the neck and around the ears, and that's just starts to go away at 2 months. It does take a full year to completely resolve in most patients. A rare patient will have a little area of numbness that doesn't go away completely, but I've yet to have a patient that really bothers by that. All right. So this is where I'm going to bring in Devin. Devin is our cosmetic consultant, and you'll get an email from Devin, right? Is that right, Devin?
Yes.
Yeah, great. So, and you can always schedule a complimentary consultation with Devin if you feel like you'd like one. Um, and I have her email posted, but of course you'll all be getting an email from her. And or you can see me. I charge a $200 fee for a consultation, goes towards the price of surgery if you decide you want to see me instead. I encourage you to see Devin, who is an expert at helping you to decide what would look best for you. And we also have a spring discount special. We are offering, as long as you have your surgery by June 30th, you will get a 15% discount off our Preservation Deep Plane VIP facelift, meaning the facelift with a VIP package. Okay, so I think that's a really great deal, and we're offering it just because we want to jumpstart this VIP process for everyone, and I hope you'll find it helpful. Um, The dates are limited that we have available. So once they're booked, they're booked. Sorry about that. But Devin can help you schedule and give you a quote and all that stuff as soon as you're ready. So with that, Devin, do we have any questions?
Yeah, so I have one question that came through in regards to the best age to have this done. So the question is, could a 65-year-old be a good candidate for the preservation deep plane lift?
So the most common age range in my practice is 50 to 70. It's that 20-year period. We see a lot of patients in their 60s. Um, so if you have your facelift at 65, you've probably been thinking about it for a while. And I absolutely guarantee that you will not need a second facelift at any point in your life. This result will last you into your 90s with you looking a lot better than you look now. The youngest I've done this procedure on in a patient who had been on a GLP-1 is 38. So with a lot of laxity, we do it at younger ages. But now we're talking about doing this in patients in their mid 40s in order to restore what has fallen to where it used to be, and then you age from there. So if you get this done in, say, you're 45, so it's a 15-year restoration. So it's not that you're going to look 30, but the tissue will be where it was at 30, and then you age from there. It's like I said, unlikely. Could you at 65 or 70 think you need something else? Perhaps, but it's unlikely that most patients will think that they need that again.
Is it common to combine a fat transfer with a facelift?
Thanks for the question. Yes, it's very common to combine fat transfer and facelift in areas of deep fat loss, either from GLP-1 or just natural aging. we the fat transfer requirements are different than if you just have a fat transfer because we're moving all that deeper tissue up to where it needs to be to create volume. But there may still be areas that require volume, and that could be temples, could be upper and lower eyelid areas, could be around the mouth, and it could sometimes even be in the midface, but that's rarer. So yes, we commonly combine fat transfer in the right patient, but we'll be able to give you a better idea about that during a consultation.
Perfect. Do you need to discontinue the GLP-1 prior to the procedure?
Absolutely. So the American Society of Anesthesiologists now recommends a 2-week absence before general anesthesia. Um, so staying for 2 weeks. But I like a month. I like a month before and I like a month after. And the reason is that we want you to heal. We don't want you in a weight reduction or a catabolic stage where you're burning down your tissue. We want you to be able to heal. And so by staying off it for a month before, not only are we avoiding all the risks of aspiration of contents from the stomach causing problems during surgery, but we're also enhancing your healing. And so a month before and a month after typically I think is warranted in almost everyone.
Perfect. Have you seen any major complications with the deep plane lift?
So that's a great question. Have I seen any? Yes. Have I had any in my own practice? No. And so I've seen, patients from other places, unfortunately, especially when patients have surgery abroad, which is, something that a lot of patients are doing these days. We've seen complications of deep plane lifting with nerve injuries and that sort of thing. There are some things that are expected. Patients will have some weakness around the mouth for a varying period of time, just from typically from swelling around nerves. And so, but that has always resolved itself. I haven't had a patient that's had a permanent injury of any kind. Um, Complications that are short term, like hematomas and seromas, we used to see a lot before drains. Now with drains, I really don't see any of those issues, and the preservation lift has really helped improve the risk of that. So we really haven't had a major complication. We had an occasional patient will have blood flow issues to the incision at the top of the ear and the incision behind the ear. The area is the furthest away with blood flow. Even with preservation lifts, occasionally we'll see a patient with slower healing there. Hyperbaric oxygen can help with that, which is one of the things that's included in the VIP package. But truly, even without treatment, those have improved on their own, and we haven't had any real issues.
Perfect. I'm ending the end of my questions unless anybody has one that they would like to. Oh, I think I just got one come through actually. Okay, so how much scarring on, hold on, let me rephrase this. So I have a patient that has a history of keloids. Is that a risk with the preservation lift?
Yes. So if you're a keloid former, so let me go back for a second to make something clear about the preservation lift. Because we're moving with very little pull, there's no pull at all on the skin edge. So on the skin edge, the pull is what causes scars not to look good. Most of my patients, after they've healed, I can't see their scars. They heal so beautifully that even someone who's super critical like me cannot see them. But in a keloid former, especially around the ear area, the way that you heal can make you predisposed to creating keloids, which is not a bad scar. It's a bad reaction to the surgery. And so, yes, we can control that with steroid injections, um, and some pressure techniques. But if you're a keloid former, you need to understand that you may need a prolonged healing process where I will be injecting your scars with steroid if you start to form thickened keloids. Keloids are not hypertrophic scars. Hypertrophic scars are thickened scars that are caused because of pulling on the skin. We don't see that at all in facelifting. We do see keloids in keloid formers. Also, in patients with Ehlers-Danlos, there's a risk of keloids forming because of the skin itself doesn't heal as well. It's too lax. Anyway, hope that helps.
Perfect.
Hope that helped.
All right. Anyone else that has a question, please type it in the Q&A box. I haven't had any come through in a couple minutes,
Great.
but if you want to leave it open for a second.
Sure. Whatever you
Mhm.
like. Devin, did you want to say anything about the process afterwards?
Like the consultation process?
Well, yeah, I mean, or what are people going to expect now that they've been watching this webinar?
So you will receive an email from me prompting to reach out if you have any additional questions. Like Dr. C had mentioned earlier, I offer complimentary consults, and I'm also in the same office as Dr. C. So he's always welcome to come into the appointment if you did want to have an official hello. But yeah, it's about an hour where we chat about the procedure, we over pricing, any specific questions that you might have, and then you will have that opportunity to meet him as well. I just have one other question that came through. Can fillers be used prior to the procedure?
So there's a lot of stuff online about fillers now. And so there are two basically classes of fillers. There's fillers that stimulate collagen formation, like Sculptra, and there are fillers that just take up space, like hyaluronic acid fillers, like Juvederm or Restylane. Sculptra, because it stimulates the way it fills is by having your body form collagen around the filler particles. And so it is harder as a surgeon to get through that area than if you didn't have fillers there. So my recommendation, but with the other fillers, it really doesn't matter. They don't do anything in terms of causing inflammatory processes or scarring. So my recommendation is have your facelift anyway, and let your surgeon, who hopefully is a competent guy, understand how to get through that area safely. I've operated on a lot of patients that have had all kinds of fillers placed in the past. And if the surgery takes a little longer because I have to be a little bit more meticulous, so be it. I mean, that's just part of the game.
All right, that might be all on my end.
Cool. All right. Well, thank you everyone for joining us and look for Devin's email.
All
Bye now.
right, bye.